Vanakkam, good morning. In this video, we are going to discuss about the color vision. Human eye can recognize the 150 different colors in the visible spectrum. When the light is passed through the glass, it produces a series of colors that is called as the visible spectrum. The visible spectrum, it has the red, orange, yellow, green, blue, indigo, violet. That is VIBGR produced. This is the spectral colors or visible spectrum. Wavelength is the distance between the two identical points. So in the violet, the two identical points in the wave of the light energy. For the violet color, it is 400 nanometer. Red color, it is 700 nanometer. We cannot see the wavelengths more than 700. That is called as the infrared rays. More than 700 is infrared rays. We cannot see the waves less than 400. That is called as the ultraviolet rays. So normally we can see the wavelength from the 700 to 400 nanometer. Wavelength is the distance between the two identical points in the wave of light energy. So blue color is around 400, red color is around 700 nanometer. Purkinje shift phenomenon is the shift of the brightest part of the spectrum when the intensity of the illumination is changed. That is the Purkinje shift phenomenon. When the light is passed through the glass, it splits into the spectral colors from the red to violet. The colors are viewed at the high illumination. Brightest part of the spectrum is the yellow color. Brightest part of this spectrum is the yellow color during the high illumination. This is the visible spectrum. Brightest part of the spectrum is shifted to the left side. Brightest part of the spectrum is shifted to the left side. But when the light intensity is reduced, low illumination, during the low illumination, the brightest part of the spectrum is the green color. Low illumination is brightest part of the spectrum is green color. This is the shift to the right side. It is called as the Purkinje shift effect. This effect is due to the maximal stimulation of the cone by the yellow color and maximal stimulation of the rods by the green color. This is the reason for the Purkinje shift phenomenon. Extra spectral colors are the colors other than those present in the visible spectrum. Colors other than those present in the visible spectrum is called as the extra spectral color. These colors are formed by the combination of the two or more spectral colors. For example, purple color is combination of the violet and red. Pink is combination of the red and white. Primary colors are red, green, and blue. The equal proportion of these three colors produces a white color. White color. So these are the primary colors. Red, green, blue are primary colors. Complementary colors. Complementary colors are pair of two colors which produce white when mixed or combined in proper proportion. Examples are complementary colors are red and green is blue, orange and cyan blue, yellow and indigo blue, violet and greenish yellow, purple and green. So complementary colors are pair of two colors which produce white when mixed or combined in proper proportions. Primary colors are red, green, blue. When these three colors are mixed equally, it produces the white color. Extra spectral colors are colors other than the visible spectrum. So combination of the one or two colors present in the visible spectrum produces the extra spectral color. Purple is combination of the violet and red. Pink is the combination of the red and white. Theories of color vision. This is the most famous theory, Thomas Young trichromatic theory. According to this theory, retina gets the three types of cones. Each one possesses its own photosensitive substance. Each cone gives response to one of the primary colors, red, green, and blue. Different color sensations are produced by the stimulation of the various combination of these three types of cones. For sensation of the white light, all the three types of cones are stimulated equally. Helmholtz trichromatic theory. According to this theory, sensitive filaments of the optic nerve for cones. The sensitive filaments of the optic nerves give response selectively to the one or other of the three primary colors. So optic nerve filaments is response selectively to the one or other three primary color is the Helmholtz trichromatic theory. Danitz studied the ganglionic cells of the retina. Granit classified the ganglionic cells into the two groups, dominators and modulators. Dominators are responsible for the brightness of the light. Dominators are further divided into the dominator for cones, dominator for rods. The dominator for cones is the response in the light adapted eye. Dominator for rod, which is respond to the dark adapted eye. Modulators are responsible for the different color sensations. Modulator for the blue, which is stimulated from the 400 nanometer to the 470 nanometer. Modulator of the green is responsible to the stimulated by the light with wavelength around 520 nanometer to the 540 nanometer. Modulator of the red and yellow stimulated by the 580 to the 600 nanometer. Hadrich polychromatic theory. According to this theory, human retina has the 7 type of the receptors. These 7 receptors divided into the 3 units. First unit is the tricolor unit that consists of receptor for orange, green, and blue. Second unit is the tricolor unit with the receptor for the yellow and blue color. Third unit is the another dicolor unit with receptor for the red and blue green. This is the Hartrich polychromatic theory. Herring theory of opposite color. According to the Herring theory, retina has 3 photochemical substances. Each substance produces the sensation of the particular by its breakdown or resynthesis. First substance is the white and black substance. Breakdown causes the white color. Desynthesis causes the black color. Second substance is the yellow blue substance. Breakdown causes the yellow color. Resynthesis causes the blue color. Third substance is the red green. Breakdown causes the red color. Resynthesis causes the green color. So this herring theory is useful for the explain the successive contrast and after images. In spite of all the theories, Thomas Young trichromatic theory, herring theories are the herring theory of opposite color are famous theories. Color sensitive areas in retina. Peripheral part of the retina is divide of cones. So it is insensitive to the color. It gives the sensation of the white, black and gray color. Central portion of the retina is called as the fovea centralis. It has the more number of the cones. So it is more sensitive to the color. In extrafoveal regions, cone is mingled with the rods. Retinal area sensitive to blue is largest, to green is smallest. Red cone, red comes next to the blue, then comes yellow color. All the color areas of retina are mapped by the using the instrument perimeter. Contrast effect. Simultaneous contrast is the effect that intensifies the difference between the two colors which are placed against each other. When black is placed against the white or white is against the black, these two colors set one another off. The black looks blacker, the white looks whiter. Similarly, the green is enhanced by the red is enhanced by the green color. Maximal effect of the simultaneous contrast is obtained when the complementary colors are placed. The reason for the simultaneous contrast is the stimulation of an area of retina by one color modifies the response in the surrounding neighboring areas. Second, it increases the sensitivity of the other colors in the surrounding area. This is probably due to the horizontal cells of the retina. Successive contrast is the effect of previously viewed color field on the appearance of the currently viewed color field. When a person look at a green object after looking at the bright red, the green object appear to be more greenish. There is an increase in the sensitivity to the complementary color. The reason for the successive contrast is stimulation upon area of retina modify the sensitivity to the successive stimuli. There is the increase in the sensitivity to second color. After images, the retention of image occur even after the cessation of the light stimulus. After looking at the bright object, if the eyes are closed, the image remains more distinct for some time, then fades away gradually. This is the after image. There's the two types, positive after image. After looking at the bright object, the eyes are closed, fixed on the block surface. So கண்ணை க்ளோஸ் பண்ணதும் அந்த பண்ண பிறகுமே நமக்கு we can see the brightest object. The after image appeared to be bright with the same color of the object. That is positive after image. So after looking the bright object, its eyes are closed, fixed on the black surface. கண்ணை மூடியாச்சு, ஆனாலும் நமக்கு என்ன தெரியும், பிரைட்டான விஷன், பழைய விஷன் தெரியுது. இதுக்கு பேரு பாசிட்டிவ் ஆஃப்டர் இமேஜ். நெகட்டிவ் ஆஃப்டர் இமேஜ்னா ஆஃப்டர் லுக்கிங் த பிரைட் ஆப்ஜெக்ட், நம்ம பிரைட்டான இடத்துக்கு போயிட்டோம், ஆனாலும் நமக்கு முன்னாடி பழைய இந்த கான்ட்ராஸ்ட் கலர், டார்க் கலர் நமக்கு உள்ள பிரைட்டான இடத்த இருந்தா சில பேர் டார்க் ஃபீல்ட் நமக்கு தெரியும். The persistent, it is due to the persistent activity of the retina even after that particular stimulus, the stimulus is stopped to act. டார்க்ல இருந்து பிரைட்டுக்கு வர்றோம், இருந்தாலும் இந்த டார்க் இமேஜ் வந்து நமக்கு தெரியுது. அதுக்கு வந்து நெகட்டிவ் ஆஃப்டர் இமேஜ். Color blindness is the difficult or inability to perceive the color. More common in males, 8% affected males. Females are less affected, 0.4%. More common causes a genetic disorder, X-linked recessive disorder. Other minor causes are injury, retinal injury, other eye injury produces the color blindness. More common causes the X-linked recessive disorder. Males are affected, females are carrier. Color blindness. Monochromatism is the one type of color blindness. This is the total color blindness or achromatopsia. The persons affected by the monochromatism is called as the monochromats. Monochromats only see the black and white and different shades of the gray color. Rod monochromatisms. In this condition, cones are functionless, totally colorblind. Visual acuity, ability to discriminate the two distinct points is separate is the visual acuity. Their visual acuity is very low. So foveal region is absent. Cone is absent in the foveal region, which result in the central scotoma. Foveal region normally contains a more amount of the cone. In the rod monochromatism, cones are absent, so they cannot see the colors. Central scotoma is the formation of the big blind spot in the fovea centralis regions. Normal people having the blind spot in the optic disc area, that is a small blind spot. Normally we can feel at the 30-degree angle in the temporal field. But in the rod monochromatism, big blind spot occur in the fovea centralis region. Another one monochromatism is cone monochromatism. In this condition, in which vision is dependent on the only one type of cones. The three primary color means only one type of cone will be present. It will not match all the three colors. The combination of the three primary colors only produces the extra spectral colors and other complementary colors. So it will not produce the other colors. But in this condition, central scotoma does not occur in the cone monochromatism. We cannot see the different colors like normal people in the monochromatism. Trichromatism. The people can see the only two colors. So two type of cone will present. The person affected by the trichromatism is called as a trichromat. Protonobia means the persons, they cannot see the red color. They cannot see the red color, cannot appreciate the red color. Deuteranobia means they cannot appreciate the green color. Tritonobia means they cannot appreciate the blue color. So this is the trichromatism. This is the second type of the color blindness. Third type of the color blindness is the trichromatism. In this conditions, three cone system will be there, but one of the primary color is defective. So these persons are called as the trichromats. So three cone system is present. One system is defective, not completely absent. That is called as the anomaly, not anobia. Protanomaly means the perception of the red color is weak. Deuteranomaly means perception of green color is weak. Sight anomaly means perception of the blue color is weak. Trichromatism, the tutor anomaly is more common compared to the other color blindness. Test for color vision, commonly doing for the government job, drivers, rail engine pilots, and the aeroplane pilots should do the color vision test. Commonly used tests are Ishikara color chart test, Holm green color wool test, Edbeach green lantern test. These are the tests used for the color vision defect or color blindness. Thank you for watching this video. If you like this video, press the like button, share your friends. Those who are not subscribed this channel, please subscribe. These videos briefly discuss the physiology topics. You must read the physiology textbook. Thank you once again.